Okay, well, I guess I'll get started. Thank you, everybody, for joining us this evening. This is a meeting for the community presentation of the Neighborhood Fresh Food Market Study. My name is Leanne Voigt, and I am the project manager for the Highland planning team that worked on the community outreach. So, team, I thought we'd do some brief introductions before we launched into some of the further information for the meeting. Stephanie?
Good evening, everyone. My name is Stephanie Hyde, and I'm a community engagement planner at Highland Planning and help to support throughout this project.
Hi, everybody. My name is Davis Craig. I am the Director of Economic Empowerment here at Connected Communities, and I was the project manager from the internal side here at Connected Communities.
Hi, folks, and I'm Ben Carrick, managing partner at KKNP. We're a food systems consulting firm, and we did the market analysis piece of the study.
Great, thank you, everyone. And you'll notice that this is a webinar format, so we do ask everybody to use the questions and answers piece. And to give you some further directions, Stephanie, if you wanted to dive into this real quick.
Yes, so if anybody needs closed captioning support, that should be on the right, down on the big bar at the bottom of the screen. So you can click that for closed captioning in any other language that you need. The chat feature, you won't be able to talk to anybody else, but you can talk to us if you need technical support for any reason. And then most importantly, the Q&A feature. This will be how you can ask questions throughout the night. You can put them in there throughout the presentation, and then we'll answer them during the Q&A portion of the presentation.
Thank you, Stephanie. So our agenda for this evening, we have 1 hour and we have quite a bit to get through because, it's been a pretty exciting, detailed project. We'll start with an introduction of the project itself. We'll give you some summaries on the community engagement, the market analysis, the financial models, and then we'll get to the meat of this, which is the food access recommendations. And we've invited a member of the Community Advisory Committee to speak. And then we'll talk about some implementation and get into some questions and answers. So with that, let's start into the introduction, and I'm going to hand it over to Davis.
All right. Thanks, Leanne. Just good evening, everyone. Thanks so much for joining us tonight for the Fresh Food Study webinar. We truly appreciate you taking the time to be here and engage in important conversation about healthy food access in the Beechwood and EMMA neighborhoods. As I mentioned, my name is Davis Craig. I'm the Director of Economic Empowerment at Connect Communities, and I wanted to start the webinar by grounding us in how we got here. So first, through our comprehensive neighborhood plan, specifically within the community wellness pillar, residents made it clear that promoting access to healthy, fresh foods is a priority in our neighborhoods. We also had commissioned a study with CGR that examined the broader food landscape in the neighborhood, and that research identified the area as a food swamp, meaning that while food options are present, they're overwhelmingly unhealthy and access to fresh, nutritious food is limited. In addition, through a capstone project with St. John Fisher, we asked residents, what types of businesses would you most like to see in the neighborhood? And the top response was a grocery store. At the same time, Connected Communities had acquired several properties that were going into foreclosure, along with an additional property we acquired more recently, giving us site control of what we're calling the market site, 359 Webster Avenue, 347 Webster, and 18 to 22 Copeland Street. And because we control this land, it made sense to focus there and ask, given this specific site, could a grocery store realistically operate here? Taken together, the documented need, resident demand, and the fact that we had site control created a clear opportunity that led us to apply for and ultimately receive funding through the federal Healthy Food and Financing Initiative to conduct a formal feasibility analysis of a neighborhood grocery store at this site. Go ahead and move to the next slide. To carry out this work, we hired a fantastic team with deep expertise in food systems, market analysis, and economic development, led by Highland Planning as our prime consultant, alongside KKNP partners, John Stover and Associates, and Glenn Kellogg Co. As part of this study, we conducted a financial analysis, a market study, and robust community engagement. Based on the site constraints, we focus primarily on analyzing a 2,500 square foot small floor plate grocery store across multiple operating models, including traditional, co-op, and nonprofit. We can go to the next slide. Early in our analysis, we saw that the financial viability of a small floor plate grocery store would be challenging. Because of those findings, we expanded our lens. Rather than looking at this single site, we also asked what other food infrastructure already exists in the neighborhood? What's already happening to promote healthy food access? And where might there be opportunities to attract new partners, resources, or complementary strategies? So, in addition to evaluating 359 Webster as a potential grocery site, this report includes broader recommendations for strengthening healthy food access across the neighborhood as a whole. We also have to acknowledge a major development that occurred during this process, the closure of Save-A-Lot in January, which was the only supermarket in the neighborhood. That closure not only intensified the urgency around local food access, but also shifted the market landscape, changing supply conditions and potentially affecting demand and capture rates for future grocery store operators. We worked to incorporate the impacts of that closure into our analysis within a relatively short time frame. Ultimately, our goal is to use this study as a tool to inform next steps, attract resources, and move us closer to improving healthy food access in ways that are sustainable and responsive to what residents have consistently said they want. With that, we'll begin walking through the findings, and I'll pass it over to Stephanie to start us off with community engagement.
Thanks, Davis. So community engagement played a pivotal role throughout this study because we really wanted to talk to people and hear about their lived experiences, needs, and aspirations, especially for those that are residents in the area in EMMA and Beechwood. Overall, we did 4 meetings with the Community Advisory Committee. They helped to provide input and guidance throughout the whole project. We had a survey out for about 3 months in the summer, and we received 114 responses. We did 2 pop-ups, the first in July at the Connected Communities Summer Bash to promote the survey and then also to gather input on what community members wanted to see at the 359 Webster Avenue space. And then the second pop-up in August was to gather feedback about improving access to healthy food and what residents wanted to see there. Then we did one resident focus group to better understand needs and identify opportunities to enhance connections to local healthy food options in the neighborhood. And then 8 interviews with community partners as a way to discuss work together and then improving food access throughout the neighborhood. And this was with 441 Ministries, St. Mark's, St. John's, Episcopal Church, Rochester Public Market, The Hope Shop, Joy Community Church, Food Link, RTS, Save-A-Lot, and Headwater Food Hub. Next slide. So the community survey, we received over 114 responses and a lot of good feedback there. Some of the key takeaways we heard is that the primary shopping locations people shop at include Walmart, Aldi, and Wegmans, followed by Save-A-Lot, and then the Rochester Public Market, which are directly in the neighborhood. There's a lot of unmet food needs, like people do desire fresh produce, but it's not as accessible as people would want, followed by locally grown food, and then meats. Also, cost was identified as the top barrier to preventing people from getting healthy food. Transportation as well, specifically with the public market, it is close, but due to the hours and depending on people's schedules and accessibility, it might not be as easy to get to. Also, people do have a strong interest in food education, so cooking classes, gardening, and just workshops. And then, as mentioned, the public market, people, it is close and people do like the variety, affordability, but just limited hours and transportation are some of the barriers. Another exciting part of the project was being able to do a fun interactive activity. This was called I Wish This Was. So we had 2 boards that we brought to our pop-ups, and we asked residents 2 questions. Number 1, what would make it easier and more appealing to buy and eat healthy food in your neighborhood? And then imagine this corner, the 359 Webster Avenue space, with or without buildings, and then to tell us what you'd like to see the property use. So the fun thing about engagement is you can put a lot of sticky notes and get a lot of great ideas. So as pictured below, we got a lot of great feedback. Some of the stuff that we heard was people do want community education. People want a space to go to that's close, and just they do want to see more access to healthy food in the neighborhood. And then, as mentioned, the focus group, this was a chance for us to get more detailed feedback about what people are currently using or not using based on just access. So people do have a good sense, the residents do have a good sense of what fresh foods and fruits and vegetables are. They don't want stuff with a lot of additives. Right now, it's just there are a lot of existing food programs, but they're underutilized due to limited outreach and communication, specifically the Beechwood community gardens. Like as mentioned, barriers persist with like cost, quality, safety concerns, limited hours depending on the store and where people are going. And then suggestions to improve this, better communication strategies, cooking education classes, and then multi-use community spaces for food access. And then just wanted to give a big shout out to our community advisory committee. They were made up of members of Connected Communities Economic Empowerment Committee, but they really worked with us throughout the whole project to make sure that we were staying aligned with what residents and community members wanted, as well as just reviewing overall findings as well. So thank you to our community advisory committee. And now I'll pass it back to Leanne, or sorry, to Ben.
Yeah, thanks, Stephanie. So I'll talk us through the market analysis portion of our research and study. And starting with just what is the purpose of a market analysis, right? This was to describe and understand the likely potential customer base of a new market and to understand dynamics in potential demand, competition, and partnership, and quite specifically to zero in as close as we could on an estimate for potential revenue that a small scale grocery store could capture within this market. How we approached that, we determined what would be the primary trade area for a market at this location. This is the area from which most of a market's customer base would come from. We also established a somewhat larger tract-based study area. This is an area that conformed to census tract boundaries, which just allowed us to get a lot more granular with the demographic data and analysis here. We then, did a review and analysis of that demographic data. We looked at the competitive landscape using data from the USDA SNAP retailer database. And then we estimated potential market capture utilizing a range of methods, and I'll talk through those. Go ahead to the next slide. So for each of these, I'm just going to kind of share the top line takeaway from each of the portions of our research. So on the study area demographic profile, kind of top line here is that the study area aligns pretty closely with Rochester as a whole on many measures, but faces steeper challenges in others, in particular with high poverty, food insecurity, and reliance on SNAP in comparison to Rochester as a whole. So the poverty rate in this study area is just under a third, 32%, compared to 28% for the city as a whole. Estimated food insecurity rate of just a hair over 20% compared to 19% for the city. And 35% of households received SNAP benefits within the year prior. So we can go ahead to the next slide. Next, looking at the competitive landscape. So the area has more food retail stores per capita than the city as a whole. This was true across all retailer types, which might be surprising. But retail is really primarily tilted toward low quality convenience and smaller grocery stores. So this neighborhood has actually more than one convenience store for every 1,000 residents, which is a higher density of convenience stores per population than the city as a whole. And it's also just important, when comparing the neighborhood to Rochester as a whole, to note that Rochester itself has a much lower density of large format retailers, supermarkets, large grocery stores, et cetera, than the surrounding more suburban areas. And as we'll mention, I think throughout this conversation, The recent closure of Save-A-Lot has a meaningful impact on this landscape. That it's a good-sized grocery store that is no longer there. We'll talk about the implications of that as we proceed. Also want to highlight a few of the key assets here in the neighborhood. Rochester Public Market and the FoodLink curbside markets are two existing assets for food access, which we think could likely be better leveraged to serve Beechwood and EMMA, and you'll see that through in the plan we'll talk through. And then Headwater Food Hub has been exploring a relocation into the city. There's a site of interest in this neighborhood. If that relocation were to move forward, that could also have a pretty big impact on shifting the food access landscape here in the neighborhood. So that all brings us to our estimate of potential market capture and economic feasibility. We estimate that a neighborhood scale market here could likely capture between $300,000 and $350,000 in annual revenue. We got to that number blending a range of methods, all of which were in pretty close agreement. We were looking at area sales per square foot estimates for food retailers, total estimated food expenditures for the population within the primary trade area, demographic data, rent to revenue ratios, and some reference figures from a prior study. And that's how we landed at that estimate for between $300,000 and $350,000 in annual revenue. And a small grocer of this size would likely need about $1 million or more annually to operate sustainably. So you can see there's a pretty big gap there, which led us to the conclusion that it would be difficult to sustain a small grocery concept sustainably without major subsidy based on what we see as anticipated revenue. The closure of Save-A-Lot does potentially shift that picture a bit, but likely not enough to fully close that gap. And as Dave has mentioned, we ran some kind of hypothetical scenarios in the financial model piece of this, which will come next. And go to the next slide. So overall, as I indicated, our conclusion here is that a new brick and mortar food retail store would face a challenging market here. And organizing our thinking around a primary goal of increasing food access for the neighborhood, there are likely many more cost-effective strategies to do that, short of a brick and mortar food retail store. So the resulting plan that we'll talk through later frames up a suite of interventions that do exactly that would support food access for this neighborhood without relying on new brick and mortar retail. And with that, I'll hand it back to Leanne and Stephanie.
And Leanne and Stephanie are going to pass it over to me.
Great.
Great. Thanks, Ben. Okay, great. So we'll go into the financial models here, and just wanted to level set before I began just about my role. So the financial analysis has been completed by the consulting team. It's primarily led by John Stover and Associates. John's not able to join us tonight, so my role is really just to walk you through the findings and explain what they mean for the site and for the neighborhood. But I'm not necessarily presenting a position or decision by connected communities, really just sharing the conclusions of the technical analysis that was completed as part of the study. So just wanted to start there. Great. So as already stated, the financial modeling primarily focused on a 2,500 square foot small floor plate grocery concept at 359 Webster Avenue. We did not conduct in-depth modeling of larger format stores. But that being said, the findings provide a useful foundation for understanding grocery feasibility in the neighborhood more broadly, whether at this site or elsewhere. For the analysis, the consultant team evaluated 3 potential operating models: a traditional independent grocer, a cooperative grocer, and a nonprofit grocer. Each model operates differently, but all were tested using national benchmarks, industry standards, and real-world case studies to reflect realistic operating conditions. Across all 3 models, the conclusion was consistent that under current site and market conditions, a new brick and mortar grocery store at 359 would face significant structural financial challenges. And now I'll go into explaining a little bit more why, and we can move on to the next slide. First, there are some physical and market constraints associated with the site itself. The building is small for grocery retail. There's limited parking, and it's located in a neighborhood setting rather than along a major commercial corridor. and would primarily serve customers arriving on foot or bike. So those factors place real limits on sales volume. Second, startup costs for grocery stores are high, typically in the range of 300 to 400 per square foot. So even at a relatively small size, there'd be some substantial upfront capital investment before a store would open. And then third, grocery business is a notoriously low margin business. Typical profit margins are in the range of 1.5 to 2%, which means stores depend heavily on sales volume and scale to operate successfully. Next slide, please. So when the consultants modeled what this specific site could realistically support under current conditions, before accounting for any potential capture of former Save-A-Lot sales, the achievable revenue was estimated at roughly $130 per square foot. And so for a 2,500 square foot store, that equates to $325,000 in annual sales. By comparison, each of the three operating models would require substantially higher revenue per square foot to break even. The team also modeled scenarios that assume a new store could capture a portion of the sales that previously went to Save-A-Lot. And even under more optimistic assumptions, the gaps remain significant. So a traditional grocery model capturing 25% of Save-A-Lot sales would still operate at a loss. A cooperative model capturing 7.5% would also remain financially infeasible. And a nonprofit comes closer, but would still require a sizable share of former Save-A-Lot sales, around 10%, along with an ongoing subsidy and favorable site conditions to approach viability. Next slide, please. Because of the difficulty of meeting all of those conditions simultaneously, the consultants concluded that opening a nonprofit grocery store at 359 Webster is unlikely under current conditions without significant subsidy or external support. And this conclusion is consistent across all three operating models. While a nonprofit model comes closest to viability, it would still require a very specific set of conditions, including a strong operator interest in the site, a higher expected sales capture, and ongoing subsidy that are not currently in place. The consultants also note that feasibility could change over time if underlying market or demographic conditions shift, such as population growth, rising incomes, or changes in travel behavior that expand the store's customer base. For that reason, the study is best understood as a tool to guide decision making as conditions evolve rather than a one-time verdict. Taken together, the market analysis, financial analysis, and community engagement give us a clear picture of both the needs and the constraints we're working with. And with that context, I'd like to turn it over to Leanne from Highland Planning to walk us through the recommendations.
Thank you, everybody. And what I would like to follow, or thank you, Davis. What I'd like to kind of follow up the presentations that we just went through and state is that there's a lot of detailed information, tables and charts and survey results, and those are all in the report that will be posted online. So if there's larger questions about some of the details and the numbers that were used, you can dig into that. And if we have time, we should have time at the end for some more detailed questions as we get through this. But please keep adding your questions to the Q&A section. So, as Davis mentioned, I'm going to be talking about food access recommendations, and these were really the final recommendations after months of study and analysis and conversation with the community and with the Connected Communities team. We developed a series of recommendations. So these are more interventions that could happen throughout EMMA and Beechwood neighborhoods in order to improve access to healthy food. So we're no longer talking about necessarily a specific market location, but we're talking about, since that is not feasible at 359 Webster at this point in time, we explored some larger scale, more regional efforts. So what some of the 6 recommendations we came up with from a high level was support the Rochester public market, support the establishment of a neighborhood grocery store in EMMA and Beechwood. This second one here was a bit of a pivot because it was initially a little bit more focused on Save-A-Lot, but with the closure of Save-A-Lot, Now this is about supporting a grocery store. Support FoodLink's curbside market, increase access to fresh food options outside of the neighborhood, and support and attract Headwater Food Hub, as well as increase community education around access to healthy food. So, under each of these recommendations, we came up with a list of strategies. And these strategies have been identified and evaluated by connected communities. And these strategies are basically helping set the stage for the next steps. So these aren't necessarily commitments to an actual action, but these are strategies to help connected communities move forward. And what you'll see on the following slides is underneath recommended strategies in greenish, bluish color is the highest priority items because these were ranked low, medium, and high based on feasibility, based on cost, and basically just kind of on the impact it would have on the neighborhood. So with regards to supporting the Rochester public market, we've talked about this being within the EMMA and Beechwood neighborhoods. It offers a wide variety of fresh, healthy food options. But there was community feedback indicated that there were some barriers that prevented the frequent use, kind of the lack of a clear reason to visit the market, transportation and scheduling challenges, which Stephanie already touched on, and even challenges with integrating into residents' regular shopping routines. So there's a lot of challenges with the Rochester public market. So some of the strategies were co-hosting community events and coordinate the funding effort. And that would be with connected communities would work with Rochester Public Market on that. Looking into the potential of establishing a Saturday shuttle service, as well as working with public market to implement a more intentional outreach and engagement strategy. The next recommendation is support the establishment of a neighborhood grocery store in EMMA and Beechwood. And like I said, this is following the closure of Save a Lot in January of this year. We adjusted this recommendation with the idea of supporting a potential new grocery store at Goodman Plaza or elsewhere if the land exists within the neighborhood. So the higher priority item within this was establish regular communication with the city of Rochester related to a new grocery store. Other strategies, identify and pursue public, philanthropic, and private funding sources really to help generate some excitement and some potential funding for a new grocer. Advance community center strategies around development of Goodman Plaza. Obviously, this leaves not only a hole in the shopping market, in the shopping network within EMMA Beechwood, but also now we have a landlord without a tenant. So how can we come up with some community-centered strategies around the Goodman Plaza? And also create opportunities for residents to provide ongoing input. Next, we have support FoodLink's curbside market. Now, there's already been previous efforts to bring the curbside market to provide access to fresh fruits and vegetables through regular stops in the neighborhood. Residents are generally familiar with the service, but it does remain underutilized for various reasons. One of the stops was Warfield Square. So recommended strategies is really exploring opportunities for connected communities to serve as a designated drop-off location. So just, kind of maybe bringing it to a different area of the neighborhood, as well as strengthening the curbside market by improving communication around times and locations. Increase access to food options outside of the neighborhood. And this is really to get the residents more easily to the resources that we have outside of EMMA and Beechwood. There was some indication that people do rely on those grocery stores outside the area, but they are still difficult to get to. So it's a lot more effort for people to do their shopping. So reducing transportation barriers were discussed, basically allowing residents to get to a wider variety of stores like Walmart, Aldi's, and Wegmans, and there's others out there. But really, the strategies were to collaborate with RTS to enhance transportation services from the Emma and Beechwood neighborhoods to stores outside the area. So really starting those conversations to see if there's, what routes go there and, what can be done. Also developing a private shuttle service came up as a potential strategy. Then we have support and attract Headwater Food Hub. So Headwater Food Hub is in the process of seeking approval for a new headquarters at East Main and Laura. And this is pretty cool because the proposed facility does present an opportunity for connected communities to collaborate, to develop strategies to expand access to affordable, healthy food within the neighborhoods. So it's a pretty neat opportunity that is kind of progressing right now. So the recommended strategies, the highest priority one was to collaborate with Headwater to support the establishment of their food hub and proposed click and collect retail concept. So really working hand in hand with Fresh Headwater. Another one would be expanding communication and outreach efforts related to their various programs. Last but not least is increased community education around healthy food. There's definitely a lot of interest, especially in our focus group meeting, about residents starting to learn from each other about healthy food, learn from experts about health and how to, process foods. We, talked about a lot of different convenient and affordable strategies for, bringing just, I guess, the education piece. And as you know, Connected Communities has two buildings within the neighborhood that can act as these community education spaces. So the two higher priority items were to update plans for the Connected Communities Neighborhood Hub Kitchen and increase access to and awareness of individual Beechwood community gardens. We know there are gardens in the area. Let people know more about them and how they can participate. The other two were partner with local artists to develop murals and educational spaces, and then develop and offer healthy food education programming. So that sums up the recommendations and various strategies we came up with. If you have specific questions about those, we can answer them during Q&A. But at this point, what we thought would be nice is to hear from somebody outside of the consulting group and outside of Connected Communities. So we've invited Mitch Gruber to provide us with a little bit of context. I don't know, Davis, if you wanted to do an introduction for Mitch.
Sure, yeah. I mean, Mitch has been a member of our community advisory committee and joined us at the beginning of the project just as a partner from his role at FoodLink. And Mitch has a wealth of expertise in food systems and has actually completed an entire HFFI study as through FoodLink, which is what we just completed. So he brings a lot of experience in and around this and is familiar with what it looks like, not only here, but across the region and the nation. So happy to have his perspective. Thanks for joining us, Mitch.
Yeah, thanks for having me. Can you hear me okay? Great. I will be very brief, but I just wanted to kind of give some overall context. That the issue that this study ultimately demonstrated um, that a neighborhood that wants a store, that a neighborhood that feels, and I think is by many measures doing really well, it does not pencil out for that neighborhood to have a store from a private business perspective is not unique to Emma or Beechwood. It's not unique to Rochester. This is unfortunately a national reality. And the timing is interesting because we're seeing right now. Obviously, I saw the question in the chat before about how much of a subsidy it is. We're seeing a conversation right now play out in New York City, as Mayor Mamdani has talked about, potentially opening up municipal led stores. And right now, the price tag that he's floated for 5 municipal stores is $70 million. Now, of course, that's a preliminary cost, which, by the way, means it's only going to go up from there. It started out at 60 during the campaign trail and is at 70 now. And who knows what actually happens with that project, but we're not talking about small amounts of money for a subsidy, even if Rochester is not New York City. I'll give a more specific example that's actually already happened. I think that really demonstrates some of the challenges that cities like ours face. So in 2013, the Chicago was led by a mayor named Rahm Emanuel. Some people probably remember good old Rambo. And Rahm Emanuel was determined to bring a grocery store to the south side of Chicago. There had not been a real full line food store on the south side of Chicago for years, decades. And so Mayor Emanuel celebrated a huge win when he convinced Whole Foods to open up one of the first small footprint stores in a community that had significantly lower incomes than your average place to get a Whole Food store. It was a huge, huge success. And in order to get them there, Mayor Emanuel lured them with $11 million in tax credits. So I don't have the numbers in front of me of how much it cost to build, but they got $11 million of tax credits given by some combination of the city of Chicago and the state of Illinois. And the store opened in 2016. By all accounts, it was a pretty nice store that people enjoyed. And then in 2022, the store closed and left. And there was a whole lot of outcry. It was really disappointing for a lot of people. The politicians in Illinois blamed Whole Foods. Whole Foods blamed the state of Illinois, the city of Chicago, as you can imagine. But the result is the city spent $11 million in tax breaks, not to mention all the other money probably spent on things that have softer costs associated with it, to get a store for 6 years, and then they were left with a vacant store. So the question is, that cities have to answer, that neighborhoods have to answer, is that worth it? Because you can subsidize a store, but you can't force a store to maintain in a space for any indeterminate amount of time. So it's really challenging. That's why I think some of the alternative solutions that Leanne recommended, or that Leanne read out of the recommendations, are really attractive. And I'll say, in my dual role as a city council member and as a leader at FoodLink, I'm certainly eager to work with this community on any of those opportunities, and to continue to make sure that we are marketing ourselves to private grocers, because that just because the numbers don't work right now doesn't mean they won't work at some point. So I'm very, very happy to continue talking about this, and just wanted to provide that kind of national context for the conversation.
Thank you so much, Mitch, and I really appreciate you joining us today. All right, so now the question we can ask is, what now? We've talked a lot. How do we make all of this happen? Well, that's where we get into the implementation portion of the plan. And if you look into the plan, I do have this QR code in the link here. Save those, because those will get you to the plan. But basically, the implementation section is the last one in the report, and it really is a practical roadmap. And this roadmap will be used by connected communities to continually check in. This roadmap, or this implementation matrix that is in the section, identifies who's leading these strategies, who the partners might be, potential costs, the impact, and really next steps for each item. Connected communities will continually evaluate and update this matrix. They want to make sure that they are meeting their mission and working towards the goals of bringing healthy food to the EMMA and Beechwood neighborhoods. And they'll use this matrix on a regular basis to prioritize and set budget needs, and really plan out their process for the year. And I can show you on the next screen, before we get to the Q&A, what that matrix looks like. But I do encourage all of you to go into the report and take a look. In the appendix, you'll see the entire matrix. And just remind you that, these are just strategies. They're not commitment to immediate action. But connected communities will continue to check in on these. These are basically all of the items I just went through in the recommendations section, but you can see it'll identify lead, potential partners, and kind of where the priority sits in the community. So this is also in the plan. So I do encourage you to take a look at that. So at this point, we already have had a couple of questions in the Q&A, but we would love to take like 10 minutes, at least 15 minutes, to have a conversation with all of you as best as we can. So please just enter questions that you may have for us into the Q&A. We did, Ben, I should mention, we did receive one question from Ian asking, how does CMI like $33,000 factor into this math? I don't know if you can see the question on your
Yeah,
side.
I'm
Not
just seeing
sure.
that. I might need a little bit more detail on what he means by factor into this math. The data that we were working with, it was all American Community Survey income data. So the area or city median incomes down to the census tract level, all align with the poverty rate pieces we were looking at, things like that. Got it. See, okay, so um, I think the distinction there is median income versus average income. So because the area, one of the sort of geographies we were looking at, what was the, oh, no, sorry, is because we were grouping census tracts, we were not able to identify a single median income for the area. So that's why that was average household income, not median household income, which can obviously really skew. Those are really different statistics. So I think that's the distinction you're looking for.
I was also just going to add a little bit of response to Paul Whitehouse's question earlier about, do you know the reason for Save a Lot closing? We reached out to the district manager at Save a Lot during this study to have a conversation and learn more about what their needs were and what type of support they need to sustain themselves and provide fresh food access for the neighborhood. And as you might expect, if you live in the neighborhood, there hasn't been a ton of busyness over there at Save-A-Lot, and you're always kind of wondering how they're doing. And what he told us was that at the end of the Q4 financials, when they got the Q4 financials in, they would be kind of making a decision about whether they would be moving forward. And then obviously with their doors closing is how we found out, like everybody else, about what their decision was. He cited a few specific financial factors. The post-pandemic, he said that some of the demand fell off for them at that location. He said it was due to delivery services being used more often. And he also talked about just some of the challenges around safety at the location and vandalism at the location having hurt their bottom line. So that's what he told me. You can take it for what it is, but that's what I heard from him, and that's as much information I've been able to gather. We've reached back out to Save a Lot since the closure, and as the city has as well, and haven't heard anything back.
Thanks, Davis. There is a question from Beth. Davis, if you could maybe dig into a little bit about what is Headwater Food Hub and what services do they provide to the public? And are they definitely coming to Beechwood, Emma?
Yeah, fair question, Beth. Great question. So Headwater Food Hub, what they do is they work with regional farmers, and they're a food hub in the sense that they bring all the produce from those farmers. They'll maybe do some light processing steps, but then they bundle up the food and they send it out to businesses and organizations like schools, hospitals, food banks. So that's their primary business. That's their food hub model. They having a special focus with working with regional farmers. They have a history here in the city. They also had a retail concept from a while ago I think it was primarily operating in the South Wedge where they were delivering fresh food produce. They discontinued it, but now they're looking at the potential of moving their food hub to the Beechwood and Emma neighborhood at the East Main Laura Street location. The reason why you haven't heard about it yet is because it is still very much in the preliminary stages. They really just reached out to us for some initial feedback and conversation. We've written them a letter of support for funding that they've reached out to. That's going to be an important part of determining whether they'll be able to move forward and whether this will potentially be feasible for them. So currently, they're waiting to find out of whether or not they're going to get that funding. But they've been in conversations with the city as well. And in addition to that food hub piece, which would be great to have in the neighborhood for jobs, and they also do a food as medicine box where people can order a food box as medicine. There's a specific program that they can qualify to do that. But they're also interested in the potential of a retail concept as well, a small retail concept. So we'll see. It's still early stages, but yeah, it would be really cool if it came to fruition, and we're definitely going to continue to follow through on that. And when they're ready, and if they're ready to take next steps, get them involved and engaged with more members of the community.
Thanks, Davis. I do want to acknowledge Evan from the public market is on with us today, and I should have mentioned this during my recommendation about Rochester about the public market. But public market and connected communities are already starting to work together on some of these strategies related to the public market, and really promoting within the Emmett Beechwood neighborhoods. So we're already starting to see some early successes and collaboration occurring here. So thank you, Evan, for reminding me of that. Are there any other questions? Davis, when will do you think the plan will be posted?
Yeah, so the plan's all done. It's all ready. We just have to post it to our website, and that should be, I would think that will be up there by Monday at the latest. So hopefully by tomorrow, but Monday at the latest.
Ashley just asked a question. Are there any other plans for the 359 Webster building?
Yes, definitely. And we really are wanting more community feedback around that. We're going to be continuing to engage with the community around that because that's the elephant in the room, right? We do this analysis. The vision or the idea was to do a grocery store there. Well, okay, if we're not going to do a grocery store there, then what's going to happen there? And we are fully committed to revitalizing that space. And in conversations, the idea that we feel that makes sense at a high level is to do a mixed commercial use redevelopment of that space, right? So a redevelopment where you have commercial space and you also have housing. So like the first level could be commercial space, the second level could be housing. And then what that specific commercial space's use would be is still to be determined. And that's where our next phase is going to come in of looking at, what other businesses would do well there, what operators are interested in, entrepreneurs are interested in coming to the neighborhood. But yeah, there are definitely plans for the space, and if you have any interest in engaging around that, please do reach out.
I will say that the results of the initial market analysis really pivoted us to talk about I wish this was with the community. And at least two events, we were able to really have some open conversations with community members. And I mean, we're talking from kids, all the adults like that came out to talk to us had some pretty fun ideas. So that was really neat to get the community involved and starting to think about what would work best in that space.
And
Nice. So,
if you haven't stopped by 360 Webster Ave across the corner, we got the Connect Lab up and running now, right across from it. So it's the space is getting going. It's starting to buzz.
go over and say hi to Davis.
Yeah.
All right. Well, I think with that, if you do have any further questions, you can reach out to anybody at Connected Communities. But at this point, I'm going to, just really hand it back to Davis for the final wrap up.
Great. Thank you, Leanne. Fantastic time management. You got us here right on time. So thanks for putting this all together and steering the ship. I just want to close by emphasizing, this study isn't something that we want to, just have a plan that we put on the shelf. We really see this study as a tool that's going to guide next steps for us to attract resources, inform partnerships, and make thoughtful decisions as conditions continue to change. The food landscape in the neighborhood is dynamic, and this work gives us a shared foundation we can return to as we navigate what comes next. We also know this isn't something we can or should do alone. So if you're a resident, operator, funder, or partner who wants to stay engaged or explore opportunities moving forward, please do reach out. My contact information is on Connected Communities website, and I'd love to talk. I also want to take one final moment to acknowledge the many people and partners who made this work possible. We're very grateful to the Healthy Food and Financing Initiative for funding this study, to our awesome consulting team, Highland Planning, KK&P, John Stover and Associates, Glenn Kellogg Co., for their expertise and just their collaborative energy, their willingness to ride the changes through the study. You guys have been really engaged and committed to making this a really useful tool. I want to also thank our internal staff team at Connected Communities. We had our own internal team that's been really working hard on this project. Our community advisory council members, focus group participants, and the residents who took the time to share their expertise and perspectives through surveys and conversations. And finally, I also want to thank the many partners who have engaged with and supported this work along the way. Thank you again for joining us today and for being part of this ongoing conversation about improving healthy food access in our community. And with that, hope everybody has a great night.
Bye, everyone.